periodontal fibers. Again, periodontal fibers is very, very important. Okay. You have 5 different types of periodontal fibers. Are you guys able to see this particular picture? Is it clear?
Yes.
Yeah.
Okay. So, you first have your alveolar crestal fibers. So, what does alveolar crestal mean? It means it is somewhere near to the crestal area, right? And it is in the nearby to the bone. So, it is going to be the topmost. Okay. That will be your topmost layer from, if you are seeing it from the tooth aspect. So, you will, that will be near to the crest. Okay. Alveolar crestal fibers. Then you have your horizontal fibers. That's one goes by the name. It is lying horizontally. So it's called an horizontal fibers. Then you also have oblique fibers. Oblique fibers run in an oblique direction. Okay. Then you have apical fibers. Apical fibers are in the apical area. And you also have the interradicular. Again goes by the name interradicular. Okay. So it is between two roots. Okay. So first is, and apart from that, there is also transeptal fibers. Transeptal fibers means, yes. So it runs from one tooth to the other. Can you see here? That this will be like a band of fibers that is running from one tooth to the other. Is this clear in this picture?
Yes, ma'am.
Okay. So, transeptal fibers will be, yes, these fibers extend interproximally over the alveolar crest and are embedded into the cementum of adjacent tooth. This is very, very important. Okay. It runs from the cementum of one tooth to the other. Okay. From, if it's, say, if there are two premolars, then between the two premolars, from cementum of the first premolar to the cementum of the second premolar, if it's running, then it's called a transeptal fibers. Okay. So, these are reconstructed even after the destruction of the alveolar bone has occurred in the periodontal disease. Okay, this will be able to regenerate itself a little later. Okay, it resists tooth separation, mesial or distal movements. Next is your alveolar crest group. Also in the alveolar crest group, if you see, it is like, what to say, it is extending obliquely from the cementum just beneath the, you don't have to remember all this. Just go through this. I will tell you what is important for exam alone. Okay, from the exam point of view. Yes, so this particular table, I want you guys to remember. You should have it by heart. Okay, so please see here, alveolar crestal fibers are there. So just the transeptal fibers, I want you guys to read it from this slide. Okay, the rest you can read it, but if it's okay. But this particular table you have to mug up. Okay, you have to know it properly. So first is your alveolar crestal fibers. So where are they? They are apical to the gingival margin. Okay, immediately below the gingival margin, it is present, alveolar crestal fibers. Okay, so here if you see, they are perpendicular to the long axis of the tooth. The orientation you should remember. They are perpendicular to the long axis of the tooth. Okay. What is one more thing that is perpendicular to the long axis of the tooth that runs from one tooth to the other? What is the other fiber?
Transeptal.
Transeptal.
Transeptal. Okay. So here if you see, it anchors the teeth to the alveolar bone. Okay. And it prevents it from shifting. That is very important. It does not allow the tooth to shift anywhere. It anchors it to the alveolar bone properly. Okay. So that is why it's called the alveolar crestal fibers. Next, you have your horizontal fibers. Horizontal fibers are there in the midway. Okay. Somewhere like immediately below the alveolar crestal fibers, like I showed you. This one. Yeah. Here it is. Okay. Immediately below the alveolar crestal fibers, you have your horizontal fibers. Okay. So it is again going to be parallel to the long axis of the tooth. Okay, like it will be running parallel to the long axis of the tooth. It will be there in the center area. Okay, so it provides lateral stability of the tooth and prevents it from tipping. Okay, tipping is very important. It prevents it from tipping. Okay, next you have oblique fibers. So oblique fibers, again, it is a little bit more apical to the horizontal fibers and it kinds of runs obliquely from the root to the bone. Okay, please remember, root to the bone. Okay, from the root to the bone. Okay, that is the direction. Next, this is going to resist rotational forces on the tooth. Okay, so any kind of rotational forces. Why this thing is important is when you collectively read your orthodontic extractions, about your orthodontic extractions in ortho, as well as about the regular extractions in surgery, you will have questions like if in case they ask you a question, what will be the first gingival, or sorry, what will be the first periodontal fiber to be affected when extracting some particular tooth? You have to answer it that way. Okay, so I will tell you that once we are done with this thing, but I'm just explaining you why this is important. Okay, so apical fibers wise, if you see, it is going to be at the apex of the root. Okay, so anchor the tooth to the alveolar bone. Also, it prevents it from dislodging both. Okay, it anchors as well as it prevents it from dislodging. Interradicular fibers means they are present between two roots, I mean between the roots of the multi-rooted tooth. Okay, they connect the cementum of adjacent roots. That's all. Okay, so this again is going to help you in maintaining the position of the tooth in its socket and also prevent the root from diverging. Okay, so basically, I hope this is clear for you all. This table is easier than this. Okay, but when you study, for the first time, I want you to go through this one also. Okay, I am not going to go and teach that. Okay, because we have a lot to cover, but at least this much you have to remember. Okay, that if you can just go through it once. And as I was telling you previously, so what do you think is the first direction, or okay, let's speak about the direction of extraction. When you are trying to extract a tooth, what is the first direction in which you will push the tooth?
Apical.
Yes, apical. Why apical?
To break the apical fibers.
Yes, we are going to break the apical fibers because that is what is anchoring the tooth to the alveolar bone. Okay, so we first have to break that bond. Okay, once we are done with it, what is the next movement that you do?
Rotation. For anteriors. For ground.
For what all teeth
Buccal
do you
traction.
rotate? Buccal traction. Okay, now let's come back to the question. For which tooth it is pure rotational movement?
Ortho.
Ortho extractions of your premolars will be
Premolars.
pure rotational forces. Okay. So, but for the other tooth, you will be combining both rotation as well as buccal and labial tipping. Am I right?
Yes.
Yes, ma'am.
So, what will be the, say, if I'm going to say, if you have to extract an incisor, what are all the principal fibers of PDL that you will be disrupting? In the order. I want it in the order.
First would be apical fibers,
Good.
and then rotational fibers, oblique fibers,
Okay.
and then
You'll be giving labial and buccal traction, right?
yes,
Horizontal
for that-
fibers. Horizontal.
horizontal
Good.
fibers.
Good. You will be removing horizontal fibers. Do you understand why this particular table is important? You
Yes.
will not be able to, like, unless you know this, you will not be able to answer that question. Okay. If you have seen this question previously, you will be able to answer. But if not, you need to understand why it is like this. Okay. So if in case, if it's a orthodontic extraction or a therapeutic extraction as such, so, or the term for orthodontic extraction is your therapeutic extraction. Okay. So for that, what are the two fibers that will get affected?
Apical and oblique
Apical and
fibers.
oblique.
That's it. Apical and oblique. Good. Okay. Is it clear, everybody? Do you now understand why this table is important? This is how you have to connect
Yes,
things in
ma'am.
study. Okay. As you go along. Okay. Yes. Again, a few more things that I want to tell you is here. See, the oblique group, this is the largest group in the PDL. Okay, so this is the largest group in the PDL, and this is what is going to take time for you to like disrupt and then cause the extraction. Okay, and here it is bearing the brunt of the vertical masticatory stresses. All the stress that you put through is going to be it is going to be bared by the oblique group. Okay, so that one you have to remember. And only one fiber does not have, I mean, it belongs completely to the gingiva and does not have any kind of an osseous attachment will be your transeptal fibers. Okay, so please go through this particular statement also. This is again very important. Okay, so it runs just interproximally. Okay.